In this video, we will guide you through the proper setup and operation of your electrosurgical unit. Start by connecting the power cord to the back of the unit, along with the foot pedal. When connecting the foot pedal cord, ensure that the large tab on the inner part of the connector is facing upwards. The connector should slide in smoothly. Turn the knob until you feel a slight click. Next, connect the dispersive pad to the dispersive cord. Then, attach the dispersive cord to the red port next to the F symbol on the face of the unit. Finally, connect the black cord of the handpiece to the corresponding black port, again, located on the face of the main unit. To install an electrode, first, loosen the protective cap. Then, insert the electrode into the collet and tighten the nose cap. If you encounter difficulty inserting the electrode, remove the cap. Align the electrode properly, fully insert it, and then tighten the cap. The electrode can have slight movement when correctly tightened. Turn on the unit. It will take approximately 30 seconds to power up. For a standard electrode, such as the RF11, set the power level to 4. When using a loop electrode, such as the RL33, adjust the power level accordingly, typically between 4 and 5, and follow the normal cutting process. Before making contact, press the foot pedal to activate the unit. When cutting, do not exceed 10 seconds of continuous operation. Allow the unit to rest for 20 seconds between cuts to prevent damage to the unit. The cut will be clean and naturally cauterized. However, this unit is not designed for extensive blood control. Using blend mode with the RSN62 cone tip allows for simultaneous cutting and coagulation, ensuring controlled penetration without excessive tissue damage. For coagulation, use a light touch to the surface of the tissue, slowly dragging the electrode without cutting. This will effectively cauterize the area. Again, when inserting a new probe, make sure no bare metal is exposed between the probe and the cap of the handpiece. Do not exceed 10 seconds of continuous operation. Allow the unit to rest for 20 seconds between cuts to prevent damage to the unit. Warning: the probe tip does not get hot. Never touch the probe tip while the machine is operating. When using the bipolar function of the unit, begin by ensuring the system is set to bipolar mode. You'll see coag on the right and bipolar on the left. Insert both ends of the bipolar forceps into the ports. Before activating the foot pedal, double-check that the metal tips of the forceps are not touching. If the tips are in contact, the system will fail to activate and may shut off or issue an error. Once everything is connected properly, press the foot pedal to activate bipolar mode. Then pick up your bipolar forceps to begin use. As you operate, you may observe small vessels or white tissue being pulled in between the tips. This is a normal function of the bipolar energy delivery. Remember, bipolar forceps are designed to seal smaller veins and capillaries, not to cauterize large blood vessels. Allow the instrument to grasp and seal the vessel fully before moving on. If the tips touch before activation, energy will not flow, and the system will not respond. With proper setup and technique, you're ready to proceed with effective and reliable bipolar operation. Always follow the manufacturer's guidelines and best practices when using this equipment. For further assistance, consult your user manual or contact support. We're here to help.